Now, let's do something related to mental health, where some mental health activists have observed that government neglect of mental health intervention is placing a huge burden on parents, especially children with various types of mental challenges. But almost 10 years after Ghana, a mental health law was passed, the legislative instrument for the implementation is still in limbo. Nonetheless, social care commissioner in the person of Andy Chey has disclosed that children who fail to have enough rest are likely to have mental related issues.
The World Health Organization predicts mental disorder will increase from 12% of global disease burden in 2000 to 15% in 2022. A report from the African Journal of Psychiatric in 2020 indicates approximately of mental disorders in adults has set in between adults ages 12 and 24. This means one every five people suffers from diagnosable mental disorders in their lifetime, among children including adolescents. The prevalence of the menace is estimated to be same as adults. The phenomenon is all-time higher. To encourage early detection of mental disorders in children, Social Care Commissioner of a UK-based NGO, Bestel Foundation, Andy Chey, speaking to TV Africa News, explained that children who fail to sleep and rest are likely to face mental issues.
I think the best way out of it is to look at alternative household arrangements, such that it is possible to, for example, if for want of a better word, if it is possible to leave the children with maybe with other siblings, with other family members, to take care of those children, because it is essentially it is the way things are, with traffic conditions, sometimes it is the only way, of course, it's the only way to beat it. But then the most dangerous thing is that it has really negative effects on the children. Children in terms of, because they begin to lose their attention span in school. We spend something like less than 3% of our budget, of our health budget on mental health. So it is really, in terms of mental health, it's really resource starved, because we definitely do not have the resources to support it. And it is one of the areas that Bestel is doing its best, in order to help support our mental health institutions.
Wellness trainer at the Art of Living Foundation, Priyanka Bagaria, on her behalf, endorses call for a comprehensive program to address mental issues in Ghana.
So the Sky Meditation Program, which is called the Happiness Program, is taught world over in 180 countries. Today, it is offered as a credit program in 107 leading universities of United States, which includes Yale, Harvard, Stanford, University of Pennsylvania, and across all the leading universities and colleges in India. So the point is that we just need to connect more with ourselves, find that confidence and clarity within ourselves. Otherwise, we are always looking at anchors outside us. Maybe it is a person that we are, holding on to, or it's a situation that we are holding on to, or we are always in the quest of grabbing and accumulating things. But when we feel that, I am the source of my happiness, or I am in charge of my feelings and emotions, when we take this responsibility, you will take out some time, maybe 15-20 minutes a day, do some breath work, feel that calmness, that relaxation, and then you are able to handle the situations around you. Otherwise, you end up in a mental hospital, you end up taking therapies, or you end up taking some medication.